What's up guys, welcome to my channel. Today I'm going to be talking about the SHA. That's our first topic. SHA or SHI, the way you understand it or the way you pronounce it. I remember a while back when in this administration, when they were bringing about SHA contributions, and Kimeumana took the government to court, and the court actually ruled that now all Kenyans with payslip should make donations to SHA. And I remember the president was celebrating, saying that wale walinipeleka kotini hata wametusaidia. Sasa badala ya wachache kulipa, kila mtu analipa. That was the celebration of the president at the time. But as we speak right now, I have seen and read about, from government officials, from Ministry of Health, begging that Kenyans should start making contributions towards SHA because serikali haina kakitu imesota. Hakuna pesa. That was the government officials from Ministry of Health complaining that serikali imesota haina kitu. Let's just listen to this step.
Number that has taken means testing stands at 3.3 million, but the number registered is close to 19.4. So we really want to urge you to undertake the means testing process and contribute your fair share, because we are talking of social health insurance where we are supposed to shield each other by each one of us contributing according to our means.
Now, this is the problem with doing things without even involving people. Without even any public participation. Kenyans for the longest time possible walitambua na wanajua NHIF na wakazoea, and I can attest even pastors were telling congregates in church to sign up for NHIF, because there is several stories, good stories pertaining NHIF. If you have been contributing, for example, 500 and the problem finds you, and then NHIF will pays for you like 1 million. You go home without even having sought any issue. And that will make people believe that so and so alisaidiwa without even using their coin. Because NHIF it's a traditional norm that Kenyans believed in. Mkenya anatoa pesa yake kidogo ile anajua. This 500, if I give out, it's automatically going to be saved somewhere. When I get a problem, I'll sort it. So those were the days of NHIF, and every Kenyans accepted NHIF except those maybe who were doing slightly better and could afford a better health care, like maybe Jubilee, Madison, Britam, and so on. So Kenya believed in NHIF all along, all through. So hii mambo ya SHA kutokea, it really hit Kenya hard. And then mpaka akachanganyikiwa.
The whole thing is very sad for this country. NHIF, and when President Uhuru was in place, they began this universal health care thing. And now what is SHA trying to do is to expand this thing so that you can be able maybe to trace medicines, whatever. And this traceability, this technologies for tracing, even these trailers you see running with goods around, that tracked, is not something that is strange. Some of these softwares are open source software that are available. Yes. And NHIF, from the evidence that is now available before us, from the Ministry of Health, they brought documents. I think they did not read all the documents, but I've been reading them. You'll find that the NHIF was just exactly doing what they are trying to do now with SHA at a total cost of 1.4 billion.
Yes.
Now, you get an addition of 103 billion.
Yes.
Added on top, just to achieve what had already been done by international consultants. They designed all these things to just 101.4 billion.
We just signed the housing bill into law. And God has a way of doing things. The piece of legislation we passed today is even better than the one we envisaged earlier. So those who went to court thinking that they will stop this, they have only helped us to make it better. So sometimes I think God uses your adversaries to work for you. Unaona vile Mungu anafanya kazi? He causes your adversaries to work for you. So this is great. We have, in this bill of today, we have a better ecosystem to work in. We have improved on the architecture of delivery of the housing bill. We have improved on the level of funding because more people have been brought into the net to contribute to the housing levy. And those who went to court thought they were going to reduce or to eliminate the housing levy. All they did was to enhance it and to increase it.
Kept
What a
wondering
blessing.
and, came up with, actually brought so many different mixed reactions. Now, when you bring this social health insurance, explaining to people, in fact, if these guys wanted this thing to work well, all they had to do is to retain the NHIF name for those who are, loyal of NHIF in the past will probably continue using it. But once you discover it's a new thing with a new brand name, with a new horror stories like what has been said, and then most would rather just keep off. And that is exactly what's happening right now, putting government in a awkward situation whereby they're now, mobilizing people, telling people, begging people, to start making contributions towards SHA or SHI. So this thing was just about the public participation and also educate people, tell people what's this, what is SHA, and give it time and then retain the name. That will work smoothly for the government. I don't think there will be a problem what people are facing in the hospital and all that. Okay, second reasons why Kenyans are not paying or contributing funds towards SHA or SHI, it's because Kenyans are overloaded. Kenyans are overwhelmed. People are paying house levy, pay as you earn, NSSF, and now there's this Taifa Care. So the moment you burden people in that manner, people begins to narrow down what they can pick, what they can pay for, and what they won't pay. So when the moment you burden people, people narrow down and see what they can pay and what they can not pay. So what I was telling you is that it's percentage based. It's not like no longer a blanket figure that used to be before, like NHIF. It's a percentage based, and the more you earn, the more you pay, and that's why the government is crying hatuna pesa. So the more you earn, the more you pay. It's not a blanket figure like it used to be before. Like NHIF, ukijua unalipapo 500 unajua that's 500 flat. 500 is going somewhere to be sorting, piling somewhere in case you get a problem with you, just go direct and see what you've been contributing, then you get sorted, treated, and go home without having paid or sorted any other issue through your pocket. So she is percentage based, and it's not a blanket figure like it used to be before, and that's why you can see governments complaining about why people, begging people to start contributing funds towards SHI, which is not there. Watu wako na njaa. People are overloaded. People are paying SHA. People are paying house levy. People are paying NSSF. People are paying, this Taifa Care. So it's hard for people to sustain SHA, and that's one of the reasons. That's why people are not contributing. So how many have used that SHA? Out of the more than 50K have contributed so far, I was told I don't qualify to use it because I'm not a civil servant. To hell with it. Reasons. At least NHIF tulikuwa tunalipa hata saa zingine hatuko job. So that's today, guys. See you in the next video. I've been your host, David Chams.